You're tuned to Radio Kidnappers, the voice of Hawke's Bay. This is the Acupuncture On Air program. Our pleasure, as always, to have in the studio Heiko from the Acupuncture Clinic in Hastings. How you going, Heiko?
I'm very good, Ken, and I'm back after my, I had 4 days down in Wellington for our annual acupuncture conference.
And what do you discuss at one of those conferences? Obviously acupuncture, but is it new trends or different ways to do things or what?
A bit of a mix. Sometimes it's some of the old stuff being rehashed, and then sometimes people have new methods, new techniques. Sometimes I speak and we just hear about their application to do a certain technique or to treat a certain condition. You know, we had a guy down there who's doing a lot of work at the Burwood Spinal Unit down in Christchurch.
Yep.
And then another speaker from China who's sort of doing more new, modern techniques. So yeah, and the beauty about it is that we have like two rooms going at the same time. So there's 2 different speakers on, so you can pick and choose.
Yeah.
And no one's really there longer for about an hour and a half. So you have quite a variety over the 3 days. So it's really good.
And did you find that the industry as such is in good heart? I mean, is it growing? Is it standing still? Is it going backwards? How did you find that?
No, well, I think it's definitely going forwards. I mean, apart from the fact that we're trying to get what's called statutory regulation with the Health Competency Assurance Act, that's in the pipeline. That basically just comes down to the government to sign it off, and that will mean we're one step forward in terms of being, officially recognised as a profession.
Yeah, indeed.
Even though we're already with ACC, but we're not quite that next step yet. When I started in 1999 here, when I came from Australia, I think we had less than 100 members. Now we've got over 700.
Wow.
There was one college. Now there's one college has got extra campus in Auckland to deal with the extra students. So yeah, it's definitely on the grow. That's
actually a lot of people. Is that 700 people practicing acupuncture in New Zealand?
That's right. Yeah,
that's a lot, isn't it?
Literally from Northland to Southland.
Is it a lot or not?
It is actually a lot. It's actually higher than proportion you'd have in Australia per population.
What do you put that down to?
I think it's partly ACC. I think because because the treatment is then covered for ACC, so it allows you to earn an income more easily.
Yes.
And that's part of the process, I think, when a student thinks, well, at least I know I can have no shortage of back pain patients when I graduate.
Dead right. Anyway, we digress slightly. So you had a good time. I suppose if I asked you, what was the one thing you brought back from your conference to put into your own business, what was it?
It was interesting because I met a guy down there, and they're actually more into sort of the business side of marketing, and they run seminars in Australia, and that's actually what I got at, and they're coming over to New Zealand next year. So I'm looking forward to being with them. It's about promotion and even like how to write a letter to your doctor and use the right words, and how to take advantage of advertising, Facebook, Twitter and Instagram and all these things, and how to make it work for you.
Get that word out there.
Yeah.
Okay, now we sort of digressed slightly there. What are we going to talk about today?
Today it's rheumatoid arthritis, and I even know that you even know how to pronounce it.
I do know how to pronounce it, rheumatoid arthritis, but it's a funny word to spell, isn't it? I mean, you look at that. That's a good Trivial Pursuit question. How do you spell it, rheumatoid?
Yeah.
Anyway, what is it?
Well, we know that from a Western statistical point of view, it tends to affect more the hands/fingers and then the feet and the toes. They get stiff, they get swollen, they get painful. They can get worse in weather changes.
Yeah.
And I'm sure you've heard the person say, "Oh, I think I've got a little bit of arthritis in my finger, or my fingers, I can feel it," and
I wonder though, often you hear people say they've got rheumatism, and you hear people say they've got arthritis, but can you have rheumatoid arthritis? So is it both into one?
Yeah, well, they break it up to have like rheumatoid arthritis and osteoarthritis, and the osteo means it refers to bones, so it's more like in the bones, where the rheumatoid arthritis is in the joint and the surrounding tissue,
right.
But it does eventually affect the bones as well. So that's why I think it gets a bit confusing for for
For
people.
old people like me.
Yeah.
Is it common?
Well, look, it affects about 1% of the population. So, in essence, you think, well, it doesn't seem a lot. But I think this 1%, is for the people who have it quite severely or quite, and I think probably many more people have it like a little bit,
Yeah.
And I guess that type of percentage I couldn't say. But
No. And do you normally get it in the fingers?
It's commonly in the fingers, and I said, and the feet, but it can also affect other areas. In particular, you can have it into the heart.
Really?
And then it can complicate things like with blood pressure and cause thrombosis, and these type of sort of heart disease, because it's like an inflammatory thing. It's like a heat thing.
Sure.
That then can spread and go.
So do you get chest pain when you've got...
You can get chest pain, so that's why sometimes it's confusing or makes it difficult for the diagnostician to really ascertain what exactly is it. And then it can also even affect the eyes.
Really?
So it's more complex than what we think.
It's a funny old thing, all right, yeah. I mean, I just thought arthritis, fingers, thumbs, feet, ankles, that sort of stuff. So in theory, obviously, acupuncture can help arthritis. So it's helping all parts of the body, including the heart.
That's right. And one of the more common symptoms that we have with it is the stiffness. And I think there's like what they call a keynote symptom, that if you have morning stiffness greater than 30 minutes, it's sort of like, oh, that's a big tick. That could more than likely be labelled then rheumatoid arthritis. You can measure it in the blood with the rheumatoid factor, but you could go and actually have that test and it would say, yes, you've got the rheumatoid factor, but you won't have a single ache or stiff joint or anything like that. So it's not always the bee's knees for everything. And so with the stiffness, we get swelling. We get pain, and then of course you can get other things. You get the tiredness and the weakness, and a mild, maybe fluey feeling.
Yeah.
And when it's severe, the joints will actually deform. And you can see like pictures. Go to Google, and you can have. You won't even be able to. To hold your spoon properly, things like that.
Yes.
It can get so bad.
I know people who've got deformed hands put down to arthritis. Can you wind the clock back on that when you start treating people with acupuncture? Say if you've got one of those clawed up hands and your knuckles are big.
Yeah, well, this is the thing. Western medicine will say it's not possible because once it's deformed, it's deformed. But particularly even when I was in China in the 80s, and then and I'd seen pictures of patients there who had quite deformed hands, who couldn't, as I said, they couldn't even hold a spoon, and they might have had two years of quite intensive treatment with acupuncture and herbs and moxibustion, and the big swollen deformed joints can change. So
hard to believe, isn't it?
It just takes time, and I think that's the clincher, that you got to put that effort into it.
Yeah. So when you get out of bed in the morning, you mentioned being stiff for more than 30 minutes, and it could be a symptom of arthritis. But I mean, everyone's stiff when they get out of bed, aren't they? But so what's the time?
No. We're talking like the stiff joints, particularly like in the hands or in the feet. And I know that I've had patients tell me that they wake up in the morning, and they can't open their hand. Right?
Right.
And so then they have to put on the really hot water into the sink, and they put their hand into the sink and massage and open up their hand and try to get it going. So we all do wake up a bit sort of stiff in the morning. We don't just jump out of bed you do.
Well, I do.
You jump out of bed and go running.
That's right. Well, just while I'm talking to you, I might as well get a free consultation here. But I've got a pain in my thumb, and it comes and goes. And it starts from here, this joint here, and it goes right around here. Yeah. And it's absolutely agony. Is that
all the time, or in the mornings?
Not all the time. Just it comes and it goes. Yeah. It was mostly gone, but over the last couple of days, it's been. It's painful, but it might not be there tomorrow. So is that a form of arthritis, or? Yeah,
well, that can definitely be a label getting into that rheumatoid arthritis, because and people will say that. Well, I had it, And it used to be like once a week I'd have it, and then it didn't have it, and then it was like a little bit more, and then it was like the intensity was getting more, and then I started getting the little finger in the other hand, and that tends to be how it sort of progresses.
Is it an age thing?
Yeah, well, see, the age, of course, does affect it, because as you age, the constitution, patterns come into account. The body is weaker. You don't absorb your nutrients as much, and things like stress build up and accumulate more. So yeah, it is now. But you can get juvenile arthritis and whatever as well, and some people can, unfortunately, they might get it quite young.
What causes it?
Well, they do say that they're from a Western point of view, that they don't really know. It's not like a concrete thing, but there is a sort of a genetic component. So they'll say that, if your parents and grandparents had it, then there's a chance that you have more of a chance that you can get it. We say environmental factors, and so that can not only just mean pollution in the air, but also if you're living in a cold, wet place, or you're living in a place that where you're or working in an environment, I don't know, on a ferry or something, where you always get wet hands. And some viruses and bacteria are also associated with it. So some researchers think that there is that connection, but they can't quite pinpoint it down. And this then correlates back to the traditional Chinese medicine point of view. All these modern viewpoints of it, that's exactly how we look at it in Chinese medicine. We have a look at, yes, it's a genetic factor. That's constitution. And Chinese medicine will say, well, your parents will pass down your weak kidney energy, or your parents will pass down the weak liver energy. That will affect the bones, that will affect your attachments with your ligaments and tendons. We have a look at environmental factors. Chinese medicine always said is that the outside environment, wind, cold, damp, heat, these things can penetrate and go into the joints. Yeah. Literally, the example that I use is that you have a football injury on your knee when you're 20, and it's painful for 6 weeks, but you get over it, and you're back to thing. But there's always a little bit of a weakness there, and we sort of say that weakness, and almost is like the force field around the knee has been damaged. That then allows the wind, the cold, the damp to penetrate in, and when you're 20. It comes in and you think, but then it accumulates, and then what happens is that you get to 40 and you think, my knee is always a bit
dodgy,
stiff now, and that was where I had that injury. Yeah. And then you get to 70 and it's like, that's that old football injury, and as soon as the weather changes, it's going to rain, they feel their knee aching away, and so then we look at acupuncture, Chinese herbs, the moxibustion, and we say is to expel the pathogens, to get rid of the wind, get rid of the cold, get rid of the damp.
That's a good point that you raised about the football injury. I mean, obviously, prevention is better than reaction, I suppose. Yeah. So at the age of 20, when we had that injury, we're bulletproof at that age, aren't we? We think, okay, we're going to be right in 6 weeks, like you say, a bit of physio, now we're back on the field running.
A bit of acupuncture.
Yeah. I was going to say, should we have had acupuncture? Because if we've got arthritis or rheumatism or both put together, we might go to the doctors, he might give us a painkiller. Yeah. But you're not going to do that. You're going to give us acupuncture. But if we had come to see it when we were 20, would we have been better
I definitely
when we were 70?
do believe, and I encourage patients to do that if they've had a more serious type injury, particularly even up to 40 or whatever. I'll say, look, we're over the problem now. Your shoulder's got all its movement back. There's no pain. But from my point of view, I don't think it's better yet. But then the average patient, I can't feel anything, so it's got to be better. Right. Yeah, exactly. But I still think it needs further strengthening and rebalancing to prevent it from, getting bad later on. And sometimes patients, people, they get an injury, and it gets like 70% better. I think, that's okay, well, I can get back on with it again. Yeah. And these are the type of ones where it never quite goes away, and then it comes back to haunt them in a different way when they're older with the rheumatic joint or the achiness when the weather changes and so forth.
So what's going to be the best treatment? Is it going to be the needle? Is it going to be moxibustion, or is it going to be herbs, or all three?
My personal experience is all three is best, but though you can use either one, you know. But particularly, you know, the acupuncture, like locally, you know, it helps to relieve the pain, and the moxibustion locally, and patients will say after, oh yeah, I definitely could feel that, it made a difference straight away. Whereas I've just give them some herbs, which is treating their like constitution and imbalance. They'll say, I don't think it's doing anything. I can't feel any change. Though I might be seeing a change in their tongue or their colour in their face, and sometimes other symptoms change. It's like, oh yeah, I'm sleeping, you know, they're sleeping better, or they're sleeping deeper. You know, they have more energy, they don't feel as tired. But then people think, well, but I don't care about that, so I just care about my achy knee.
That's right.
But it does take time to get rid of that as well.
When people come to see you for that sort of treatment, and you say you're going to give them acupuncture, moxibustion, and the herbs, is that 3 separate treatments, or do you do the whole bunch at once?
Yeah, basically at once.
Yeah.
Like, fundamentally, they'll lie down. I'll put the needles in different spots, and as you know, like they might have it in their hand, or they might put needles in their elbow or their shoulder for that. Often the moxibustion is quite local, particularly in rheumatoid arthritis. I'll do it directly right onto where the swollen joints are, and I would do that on you.
Yeah.
I mean, I could maybe even bring some in here and do it if we're filming it, just as long as there's no smoke alarms.
There's no smoke alarms. There's a smoke one up there. We could just do the needle.
And then I will work out and then work out the herbal formula, and then usually while they're lying down relaxing, I'll mix those herbs, and then they take them away with them. So then they might take the herbs once a day, twice a day for a week or two. Come back to see me. And if it's particularly painful, then I would recommend more intensive acupuncture. It's just to help to get on top of the pain first, and then let the deeper constitutional type treatments then help to regulate and to have if the right word, though I'm not allowed to use it, is the cure for the long term.
Sure, that's right. So a course of treatment is what, 6 weeks?
Again, it depends how severe. Like, I mean, as I said, if you see people and they've got like deformed joints and they can't hold a spoon, you could be looking at a couple of years of treatment. But someone that's just starting to notice a few of the joints, I would suggest, I get results with people coming once a week, and they might become once a week for a few months, and then they'll be saying, look, I can definitely feel it improving. I do think it would improve faster if it was maybe twice a week or 3 times a week, but that gets impractical sometimes for people.
Yeah. Not that I want to put you on a spot, but can you give a guarantee? So someone comes in, they've got that problem where they can't hold a spoon because of their hands. Mm-hmm. Can you say to them, I can guarantee in 2 years' time I can have you hold a spoon?
Yeah, I'd love to be able to say that, but again, I sometimes just wonder the people who, because I do get people that ask that.
Yeah.
And for want of a better word, I often find that these particular people who want a guarantee, they're actually sort of quite negative. I actually don't think they will get better or want to get better. It's almost like they're trying to get me to confirm to them it's not going to work.
Yeah.
Because for one, we're not legally allowed to say you can give a guarantee. No. So they're sort of asking something that we know that we can't actually say. And then even if I showed them pictures like from the textbooks, whatever, and try and say, well, this is 1 year's treatment, this is 2 years treatment, they change. And then, but will it be the same for me?
Yeah. But you could guarantee almost that they would feel better.
Yeah, I mean, guarantees are a funny word.
Yes, that's right. Yeah, exactly.
And what I try to do is to suggest people say, look, you want to try at least a fair course to give it a go, which is at least half a dozen sessions.
Yeah.
And then I sort of think, like, if there's absolutely no change in 6 sessions, then I would say me with my technique for that patient is not working.
Yeah.
But then I'd say, but it might be that it would have worked better for someone else. And I've seen that, patients will say after a couple of sessions they can definitely feel a little bit of change for quite a chronic stiff joint or whatever.
Yeah.
But yet other people know. you know.
Yeah.
Unfortunately, it's just...
not one rule fits all.
Yeah, that's right, yeah.
Exactly. Just about out of time. We've got heading up to one of your weird songs that I've never even heard of. But
No, don't tell me you cannot have heard of this song.
Before we get to it, just remind our listeners, if we want to come and see you, where are you?
I'm in Hastings. My website is acu123.co.nz. But this song Exodus by Bob Marley and the Wailers, I mean, I think if you read Google or, you know, Melody Maker reviews, I mean, this album and particularly this song is sort of regarded as one of the top songs of the 20th century.
Yeah, crikey, this shows you how behind the times I am.
You're way behind.
Good on you, Heiko. As always, our pleasure. You look after yourself. Talk to you same time, same place next week.
Okay, look forward to it.